Hello, Healthy Congregation Churches. Thank you so much for your willingness to join us for this webinar. This is Katie Schoenhoff at the Fund, and I wanted to let you know about an exciting opportunity that we are wanting to present for you. As you may know, we've been having conversations. We first started telling people at the Healthy Congregations Retreat, and we're planning on also letting you know about other opportunities, but we are expanding our special grant opportunities. So you may have heard about the neighboring movement in the last one, and as well as the Big Gardens Project and also the summer food program. So this is our newest one, and we are really excited about this partnership. We have been in correspondence and working with Thrive Allen County to talk about the potential for doing a bike share program and allowing sites across the conference to be able to have access to technical assistance and support from Thrive Allen County. And we want to talk more about that today. So this webinar, and as you're thinking about, I know for timeline and stuff, this may be a timely piece for you to be aware of. And so we wanted to bring this before you as soon as possible so that you can be considering this in the upcoming months. And again, we're excited to partner with you. For those of you who may not remember, the only thing that is required to be eligible for special grant opportunities is that you are signed up as a Healthy Congregation Church. Once you've filled out and completed your sign-up form, you are actually eligible. For those of you who are already certified, we do like for you to maintain your certification, meaning that you're continuing to complete your plan needs assessment and report annually. This is a really great opportunity, and we're excited to be working with Thrive Allen County. We think they're one of the great programs across the state that we've been able to work with and learn from, and hope that you will feel the same value from them as we have. With that, I'm going to turn it over to Lissa Regier for her to talk to you about the opportunities and what's happening. So thank you, Lissa.
Thank you, Katie. Hello, everyone. As Katie said, my name is Lissa Regier, and I'm the President and CEO of Thrive Allen County. And today I'm so excited to share with you about Thrive's partnership with the United Methodist Health Ministry Fund to provide 5 Bike in a Box programs to Healthy Congregations communities. Before I begin, I want to share a little background about Thrive and the community of Allen County, Kansas, in the hopes that this better illustrates for you the way that bike share could work in your own rural communities. So I'm going to start off by giving just a really quick geography lesson. Allen County, Kansas, where Thrive is located, is marked by the red star you see here on the eastern side of the state. We have a population of 13,000 people spread out over 505 square miles. Allen County is in the southeast part of Kansas, and this is an area that has often been referred to as the Appalachia of the Midwest because we tend to be poorer, less educated, and have much worse health outcomes than our counterparts in other areas of the state or even the Midwest in general. In 2007, a group of volunteers in Allen County got together and said they weren't okay with the trajectory of our county. They didn't like seeing the rampant poverty, the graduation rate dropping, or the lack of access to health care that our residents faced. They wanted to believe that tomorrow would be better than today. So they formed Thrive Allen County as a 501c3 coalition. Thrive began with the focus areas of health and wellness, recreation, and education. And then a couple years later, we added in economic development and advocacy. Our vision is that Allen County will be the healthiest rural county in the state of Kansas. We have a long way to go with our vision, but we have made some progress. In 2011, the county health rankings put Allen County at number 94 out of 105 counties in the state. And this year, we were able to move all the way up to number 38. So progress has been made, but like most rural communities, we still have a long way to go. One of the ways that Thrive has gone about creating a healthier and more thriving culture in our community is through our built environment. Over the past 10 years, we have gone from 0 trails in Allen County to more than 40 miles of trails and routes, and that number continues to grow. The immediate goal of our trails was to get more people walking and biking, but the longer-term goals are pretty ambitious. We want to improve our physical and fiscal health through more active lifestyles and the subsequent savings in healthcare costs and transportation costs that those active lifestyles bring about, as well as an increase in economic activity. The first trail system that we built through volunteer labor was the Southwind Rail Trail that opened in 2013, marking the beginning of a new culture of riding on trails in Allen County. The Southwind was such a success that at Thrive we decided we needed more trails and more unique and diversified trails. So we created another all-volunteer built trail system, the Lehigh Portland Trails, that opened in 2016. This particular trail system really opened up the floodgates of the biking culture in Allen County, so much so that later that year we were able to recruit a bike store out of Kansas City, which is an hour and a half north of us, to open a bike shop in Allen County, our first bike shop. As we saw the bike culture grow, we knew we wanted to make it even easier for people to have access to our trails on more than just foot. So we had talked a lot about implementing a bike share program for years at Thrive, but had not quite come up with the best model to move forward with that idea. Typical bike share systems like those found in metropolitan areas are expensive to set up and run. There's the cost of the bikes themselves, the docking stations, the kiosks, the payment systems, and staff. All in all, it can require an upfront investment of $4,000 to $5,000 per bike. That's far beyond the means of a small rural county such as ours. And even if we could secure the capital to launch such a system, our largest audience, many of whom live in poverty with no access to credit cards or smartphones that are often required for these systems, would still be unable to use it. And for us, that defeats the purpose. So clearly we needed another model and one more in character with our community and its needs. So what we settled on for our pilot project that we launched in May of 2017 was based on the bike library model, where the bicycles are available to check out by the public for free, just as you would check out a book at your public library. We decided to use single-speed cruiser-style bikes, which are a great fit for the terrain in Allen County, and also handle wear and tear better than bikes with multiple gears. And as you can see in the picture, we have a very simple setup for our bike share stations. A simple frame that is bolted into the ground for our bikes to be locked up to. The establishment that the bike station is in front of in this picture, whether that is a retail store in this picture, but whether that be a retail store, a nonprofit, an industrial employer, a school, or a library, they have the keys for each bike, and riders check in and out by physically going into those organizations, which brings foot traffic into local stores and businesses, which they really appreciate. We utilize a Google Docs format for our checkout and in process and our tracking system, which makes our model very simple and easy to use, which is a plus when we're partnering with other businesses who need to easily be able to access and use the checkout system. When we piloted the Allen County Bike Share program, we had 10 bikes, 5 outside of our office on the downtown Iola Square, and 5 outside of a retail store that was open evenings and weekends when Thrive was not. We wanted the bikes to be available to out-of-town visitors who wanted to explore our town and trails by bike. We also wanted to have these bikes available for local community members who needed them for recreation or transportation as well. The checkout process is simple. The rider provides us with a photo ID that we scan for our records. They sign a waiver and are loaned the bike for a 24-hour period. Children ages 12 to 17 must have a guardian's signature to check out a bike. The first week we opened the Allen County Bike Share program, we discovered that this would be so much more than we envisioned it to be. The expectation for most bike share programs is that out-of-town visitors will use them to check out trail systems and ride to explore your town, and that does happen. We have children check out the bikes for town scavenger hunts, as you can see on the bottom of your screen. We have residents check them out to go for day rides around our community, and we have out-of-town visitors check them out to explore or ride with family members they're visiting who have their own bikes, but not enough bikes to spread around, and they want to show off our beautiful community and our trails. But what we've learned very early on, in the first week of opening our bike share program actually, was that the reality of Allen County Bike Share was much more than Sunday bike cruising. It was a lifeline. The picture you see on your left was taken the first day our bike share program was launched. Those are bike share bikes outside of our federally qualified health center, where residents go if they have no health insurance or are lower income and need health care. It was located on the east side of town, and our bikes made it much easier for residents to make it to their appointments. Gates, which is our largest manufacturer in Allen County, now has a bike share station outside of their factory. They have employees who either do not have vehicles or do not have reliable vehicles, an issue that is prominent among our residents in Allen County. Employees of Gates utilize our bike share program to make sure they get to work on time. The majority of our bike share users fit this model. They're fry cooks at Sonic or McDonald's. They work in our local factories, many of which are a 3 strikes and you're out tardy system, so reliable transportation is a must. Some of our residents that need an easier way, some of these are residents who need an easier way to transport groceries or make it to doctor's appointments or the bank. And then, if you look in the middle of your screen, I have a quick story to share with you. Then there is Mark, a gentleman in his 50s whose bike share bike is pictured in the middle of your screen. Mark was a regular bike share user, and one evening he was at home with his niece when he started to feel sick. His niece encouraged him to go to the ER, but Mark said no. He couldn't afford the ambulance to get him there. They had no vehicle for her to take him, and as his symptoms worsened, his niece became more adamant. Uncle Mark, I think you're having a heart attack. You have to go to the ER. Again, Mark said he couldn't afford the ambulance. But then he remembered his bike share bike that was sitting on the front lawn. I'll ride my bike share bike there. That's what he said. Now, this is where I like to tell everyone that we do not in any way, shape, or form encourage riding your bike to the ER. In fact, it often will just make things worse. Please call an ambulance. That's my disclaimer. But that is exactly what Mark did. He rode his bike to the ER, where he walked in and said, I think I'm having a heart attack. And could someone please call Thrive and tell them their bike share bike is here? And that is all a very true story. And that picture you see is of Mark's bike before we picked it up. We like to say that our bikes literally save people's lives. Mark, for any of you who might be wondering, is doing just fine. He recovered, and he is still a regular user of our bike share bikes. Through the United Methodist Health Ministry Fund, Thrive is able to provide 5 healthy congregation communities with our Bike in a Box program, modeled off of Thrive Allen County's bike share program. The Bike in a Box program provides 5 bikes, typically single gear cruiser style, a bike rack, and 5 bike locks, signage with your community and or bike share program's name, customizable damage waivers and check-in and out forms, and in-person training on how to use the system, as well as ongoing support from Thrive staff if you need help. With what we've learned in Allen County, with our bike share program, I want to share a few takeaways with you. 1, bike share is a win-win. We like to say it's sexy. The residents love it and benefit from it, and our funders love it. We were able to write grants to local health foundations after our pilot project was a success in order to build up our fleet of bikes and cover more towns within our county. We've worked with many other rural communities in Kansas to build their bike share programs, and they've also been able to write further grants or find other sources of dollars to build up their programs. Family foundations, community foundations, and individual donors are just a few other ways we've seen bike share programs come to life. As I said earlier, bike share is a way to introduce new people to your community. But more importantly, in small rural communities, it's a way to break down barriers that many residents face, especially in the area of transportation. For any of you that have a community college, VOTEC college, or 4-year institution in your community, bike share thrives in these environments. Our community college houses 10 bike share bikes that are constantly checked out, especially amongst our international students and out-of-town students without a vehicle. It's become a lifeline to the community for them. Bike share appeals to out-of-town visitors, and you want it to. You want people excited to stay in your community because they have different ways of exploring your town and different modes of transportation they can utilize. But you have to make sure they can access your bike share program, and this is where partnering with local retail stores or businesses that tend to be open later in the evenings and on weekends is very important. And the final takeaway is that you have to be flexible and able to evolve. Bike share works differently in every community. There are rural bike share models where every bike is donated and you can't tell when someone is on a bike if it's a bike share bike. We opt for our entire fleet to be recognizable and easily identifiable as our bike share bikes. There are programs that charge anywhere from $5 to $25 a day for a late fee in order to keep people more responsible and taking care of the bikes. There are bike share programs that utilize long-term and short-term loans. This is something we do, especially for trusted bike share users who are dependent on our bikes to make it to work. As you move forward, you will learn what works best for you and your community. We continue to learn and evolve as we go through our own process. In the first year of our Allen County Bike Share program, our bikes were checked out 565 times. We grew from 2 locations on the downtown Iola Square to 7 locations throughout the county, including in a town of 100 residents where they have 2 bike share bikes housed at their local library that are regularly used. We are continuing to expand and we are continuing to learn. There are riders who are no longer allowed to check out bikes due to mistreating them, but not as many as the naysayers told us there would be. We were told that people would steal our bikes, trash them, abuse them. Very seldom does this happen. For those who do mistreat the bikes, they're invoiced for the damage. If they can't pay the invoice, they can do community service that is valued at $10 an hour until they pay off their damage to the bike. We've gone with a system where our bike fleet is easily recognizable. Pink, red, and yellow bikes. They're easy to spot. In the first week of launching our bike share program, I had people texting, Facebook messaging, and calling me to tell me so-and-so had a bike share bike at their house. And I had to respond that that was okay. They're allowed to keep them overnight. But thanks for letting me know. The community is vigilant about these bikes. They appreciate them, and they are proud of them. So hopefully I've got you excited and interested in starting your own bike share program for your community. If so, you might be asking yourself how to qualify for your own Bike in a Box program through the United Methodist Health Ministry Fund. Here's a quick list of criteria to help you decide if you're ready to begin the process of bringing Bike in a Box to your community. First, as Katie said early on, you must be a healthy congregations community. Next, have a lead individual to work on the Bike in a Box program, along with a team or coalition to assist in making this program a success for the long term. In order for this program to be a success, you need to have a group of dedicated people behind it. The last thing we want is to install the bike share program, and within a couple of months, no one is using it because there wasn't proper education, marketing, or buy-in from your community and group members. You also need the proper location for the bike share program with an ability to assist bike share users with checking in and checking out bikes, answering questions, etc. This is key to the success of your program. We're happy to talk you through possible locations if you have a few in mind. Take into consideration the amount of hours a location would be open, the availability of someone to check bikes in and out, the physical location, and how easily accessible it is for people to get to. We also need you to have ideas or connections to possible bike repair volunteers or a local bike store that can help maintain the bikes. We will work with bike stores close to your community to order the bikes for your bike share program. We want to support your local businesses. Long-term maintenance is key to a good bike share program, and we found that the most affordable model for us is to utilize volunteers to maintain the bikes. Lastly, we're looking for enthusiasm, excitement, and the understanding that every community is different and unique, meaning every community's bike share program will operate slightly differently. Flexibility and openness are key. We recently added a couple of trikes to our bike share fleet to allow people with different abilities to also use our program. If your community is older or has many people with different abilities, this might be of interest to you as well. Originally, the Bike in a Box program was designed with solely two-wheeled bikes in mind, but we understand that every community is different and the needs are different. And if you believe a trike or 2 trikes would be better than all two-wheel bikes, we can talk about that. If you are in a hilly area where single-speed bikes are going to be a struggle for many riders to use, let's talk about that too. We want your first go at bike share to be successful. And part of that success is making sure you have the correct bikes for your community. Another point I want to make is that although Thrive has spent years building a bike culture through trails, we have worked with communities with no or very few trails to also implement a bike share program. You do not have to have trails in your community for a bike share program to succeed. In fact, by bringing in a bike share program, you might see more interest in biking build in your community, and this could actually be the impetus for building more bikeable areas like trails in your community. And also, marketing is very important in getting the word out about your bike share program. If no one knows about it, no one will use it. We can talk with you more about this as we begin working with you to implement your bike share program, but we're definitely going to want to make sure your community is excited and ready to utilize that bike share program when you launch it. Thrive has led so many programs and initiatives over our 11-year period, but our bike share program is by far one of our most recognizable, loved, and used programs. And one of my favorite things about it is that we have been able to address, not fully, but in a very small part, an issue that has been haunting our community for years and that we're still working to figure out, and that's transportation. Our bike share bikes cost on average $400 per bike. We have a volunteer who does the maintenance on them, and we pay for the parts. To see our residents keep their jobs, make it to their doctor's appointment, enjoy our trails, and more easily get their groceries, all because we are able to provide a free rural bike share program for them, is a really wonderful feeling. I am so proud every single time I see someone on our bike share bikes, and I see multiple people on them every day. Free rural bike share programs are one more piece of building a cycling culture in rural communities where bikes provide an easy, economical way to access services and break down barriers residents would otherwise encounter in their daily lives. And we highly encourage rural communities to look into creating your own versions of bike share programs for your communities. You won't be disappointed, and you might just save someone's life. So this is my contact information. If you guys are interested in starting up a bike share program, I do want to let you guys know, remind you, this is a competitive process. We will only have 5 grantees selected this year for the bike share program, so remember that as you are preparing to get in touch with me. This is competitive. I just really want to thank Katie and the United Methodist Health Ministry Fund for this amazing opportunity to work with the Healthy Congregations community. Thrive is so excited to partner with all of you and to watch bike share grow in your communities. And I want to thank all of you for your time. And I really look forward to working with you and beginning your bike share program.
Thank you so much, Lissa, for that great presentation. One other thing I wanted to mention before we finish up for the day, as Lissa was mentioning earlier, as we're talking about that community piece, we've been talking more and more about how it is really important to not work in silos within our congregations, but really think beyond the walls of our church and think about how we engage within our communities, and that you are a key player in the community and with numerous organizations. And so we strongly encourage you, as you're thinking about this program, consider how you can work within your community. We're suggesting that this is not just for your church, that this really needs to be a community undertaking, and getting key people involved who are part of different coalitions, either like a Live Well coalition or something of that nature, or as well as different organizations who are dealing with health, or as Lissa mentioned, your public library system, your city. There are so many people who are interested in this work, and this is just a great way to be able to begin conversations, if you've yet to do that, with how to work in your community to try to work together on supporting the needs of those who are living there. So we ask you, as you're thinking through that would be a key piece of this, that this is not something that we want siloed, but we want you to be working with others so that you have the best option and opportunity to help those that would like to use the bikes. With that, unless Lissa, if you have anything else to add after that.
No, I think that was perfect. And I think this could be a really great introduction to really building those relationships outside of the church. I think this could be a really great program to start that.
Great. And I completely agree. So with that, I'm going to close. And again, I thank you guys for your interest in this, and we hope that you will see this as a valuable opportunity to work with great group of people out of Southeast Kansas who are learning how to work with their communities in new and fresh ways to really address the needs for rural and other needs too. So thank you again, Lissa, and we look forward to hearing from you. As Lissa mentioned, when you are ready, or if you are interested, the way this process will work is that you will need to reach out to her to begin the conversation and figuring out if you will qualify, and as we put that process together. Lissa and I then will be working together to determine which sites will be selected. And so you will then find out from there if you become one of the sites who will be one of the first 5 to receive the grant associated with this. So thank you. And please feel free to reach out to Lissa, or if you have other questions, you can also contact me at katie@healthfund.org. Thanks a lot.